Well, my dad was in the Air Force, and so that caused our family to move frequently. So we grew up all over, and it was a pretty interesting experience. I guess I would call San Antonio home at this point. My parents still live there. It was interesting. It was always a new environment, always a fresh start. It was hard being the new kid, moving every time, but I got to meet a lot of great people, and it made me more adaptable, I think. I think my father probably has. He taught me at a very early age that having a steady work ethic was very important, and that I could achieve any goal I wanted to achieve. I think most people are surprised to find out that I'm actually a tomboy, and I grew up very much a tomboy. Liked to get dirty, had bruises, I had a little brother, so I guess that's what influenced that. I love spending time with my family. We like to do a lot of outdoor things, hiking, trail running. I love football. With my mom being a nurse and my dad being a hospital administrator, I was around medicine from an early age. Grew up volunteering in the hospital and those kind of things, and I always wanted to go into medicine in some avenue, even as a child. I was a physical therapist first, and in my training as a physical therapist, I was working in a neuro rehab unit and really fell in love with the population of patients, and then also what the neurologist's role was in their care. And that's what prompted me to go to medical school. I loved that the neurologic exam could lead to a diagnosis without any other modalities or any other diagnostic studies. And I loved the population of patients that the neurologist was treating. It seemed like most of them had a will to get better and were compliant with their plans and an active participant in their care. I try to treat each patient as if they were a family member and try to go into my approach towards them as if I would, were they my mother or my father.